Hello and welcome to Healthcare IT Today. I'm Colin Hung, and over the past few days, we have been here in Nashville, Tennessee for the NextGen user group meeting. The NextGen team was kind enough to invite us down to cover their event, and the company gave us a free media registration. But we have paid for everything else, and this video is not paid for. Now, here at the conference, the company has been talking a lot about their Ambient Assist solution and their closed-loop practice and patient experience platform. The reception for Ambient Assist has been very positive. Here is CEO David Sides with more details about that.
Oh, the response has been fantastic. So 2 years ago, we talked about, we didn't have it named Ambient then, but I was like, look, there's going to be this technology that starts to develop. This is before ChatGPT even, where you can start to have a conversation. It's going to start to be able to, parse that and be a help to the clinician and not have physicians be content creators, but content editors. Then, 4 months later, ChatGPT came out and everyone's like, oh yeah, this is great. We were already working with other models. We don't use ChatGPT in most of the things we do, but because it's good for summarization, but not good for listening or picking medical terminologies out. So we use multiple models to refine the one before, which also reduces any hallucinations. And last year we brought out, and we had at our user group, we had Santa Claus who was overworked being interviewed. And that was through an ambient conversation. It was like, look, this is real now for documentation. We're going to keep working on orders, billing, quality measures, and we've got all of those things either done or almost done or in the roadmap. And so this year we were able to say, here's what's happened in the past year. We've got hundreds of users. We're doing over 100,000 encounters a month. So real volume is going through the system. And when I mentioned it yesterday, there's one provider who had done 1,200 encounters in a month. They only use that solution, and he was sitting in the front row. So I was like, oh, that was you. That's great. I mean, that's really quite a lot of encounters in 1 month, but just shows you the uptake. So we're just doing hundreds at a time now. It's on the curve.
NextGen's focus on improving patient experience was evident with all the signage and demonstration areas for their new closed-loop practice and patient experience platform. It is more than just appointment reminders and patient self-scheduling. The company has also been showcasing the patient intake capabilities and how they are making the payment side easier for patients. In other words, closed loop is taking a 360-degree approach to patient experience. Here is Jenna Hagen from NextGen with more details about closed loop.
So NextGen closed loop patient and practice experience is really the evolution of connecting technologies and workflows to provide efficiency for patients and for providers and practices, enabling technology like patient experience, digital documentation, payment workflows, providing that seamless workflow for an organization through technology. Patient could be reminded that they need to come back in for due care, right? But instead of a staff having to run a report and make that phone call, let's let a system know that they're due and automate out that message for the patient. It could be that a new patient to an organization, like myself, I just moved to a new city, I'm looking for physicians. I'm Googling online primary care physicians. That reputation management is going to make me as a patient want to go see that organization and have access in. It could be that I, as staff, automated messages to say, hey, click here to get scheduled. Or, hey, would you like to be seen sooner and join a wait list? Instead of staff having to make those phone calls, we're enabling technology to let patient have that self-serve access through automation.
The benchmarking service that NextGen launched a couple of years ago is starting to gain more traction. Here is Sri Velamur, President and Chief Operating Officer, with more on that.
Yes, so we invested in an enterprise data warehouse a couple of years ago. So we have access now to take EHR and practice management data from all of the clients who are on NextGen, put this in this warehouse, and slice and dice it, and then start to show them how their performance is not only historically trending for themselves, but comparing them to the other specialties and practices that look like them in their peer group. So now giving these folks these benchmarks through this enterprise data warehouse and the dashboards that we publish for people, they can figure out exactly how much potential they're leaving on the table. not only for RCM reimbursements or how fast a physician conducts an encounter or how much satisfaction a patient is achieving from using their practices. So an incredibly powerful tool for us to partner with our clients.
One of the things that attendees seemed to really appreciate was the access they had to the support teams and product experts here at NextGen. If they were having a challenge or an issue, the right people were here to give them an answer. There was even a friendship bracelet station where people could channel their inner Taylor Swift or maybe prep for the next T-Swift concert. Here at the UGM, there were a number of partners who work closely with NextGen and, of course, NextGen's customers. We caught up with several of them to learn what challenges and topics they are discussing with attendees.
All right, my name is Kelly Irvine. I'm with JP Morgan Healthcare Payments as a Vice President of Product Solutions for the Instamed solution. I'm at NextGen UGM 2024, and we are hearing a lot of clients talk about the desire to drive down their paper processes and have more electronic delivery, whether that's e-statements or they're receiving payments from their payers. And then we're also hearing a lot of people that want to drive down the amount of calls they're receiving in their office by having easier to read statements, easy to understand billing processes so they can go right online, self-service those payments, and really take some of the pressure off of the office staff.
Hi, my name is Dan Romano, here representing LK. My role is Director of Strategic Ambulatory Accounts. Great show so far, having a lot of great conversations with some longtime NextGen users, getting a better understanding of their current needs. A lot of them have been on the system for a long time, accumulating a ton of data. So what we're talking about is methods to remove some of that data from their application or their server, utilizing our services to help improve performance so they could see some benefits of archiving data for long-term storage.
All right. Hi, this is Liz from Serge Mate here at the NextGen User Conference in Nashville. We're so excited to be here. What we've seen a lot of is there are a lot of practices that really care about their employees, care about their patients, and they're really looking for innovative tools to streamline processes, standardize workflows. And it's just been really exciting seeing people collaborate with one another, learning a lot from the sessions about how to use the technology that's available to really supplement the great things that NextGen has to offer and make things better for everybody.
Hey, my name is Colin. I'm an account executive with Dedicated IT. We're here at the NextGen conference talking to a lot of healthcare groups about how their different pains they're having with IT when it comes to day-to-day support, and also what the future looks like when it comes to technology and different innovations and ways to streamline their practices. Everyone's been talking about hosting, if they should host, if they should stay on-prem. It's been a huge conversation. It's great seeing everyone at these events.
I'm Laura Miller. I'm the CEO of TempDev. So some of the exciting things TempDev is doing right now is we're offering a lot of new business intelligence solutions. We built it on the Power BI platform. We really aim to look at operationally what our clients needed, because I feel like patient population, health management, all of that is already taken care of. But like, what is actually going on in your practice and how can you monitor it effectively? So we went to the drawing board and we built out EHR operations dashboard that are your providers signing off on what they need to sign off on? Are they doing things that they need to be doing? What's your patient throughput? Where are you getting stopped with patients? Because patients don't want to wait in waiting rooms anymore. We also did a lot of work with the revenue cycle and also appointments and scheduling and everything else, just so you can see overall from an executive view what's happening in your practice.
Hey, so I'm Nick Baxter with Consensus Cloud Solutions. It's great to be here. We've been working with many NextGen organizations to streamline inbound document workflows. They've been getting excited about how we deliver efficiency, reduce rekeying errors, and ultimately save costs by eliminating manual data entry, thus enabling staff to work at the top of their license.
Hi, my name is Megan Leonard. I work for Clinex Healthcare. I'm a client success manager, and I am attending UGM here in Nashville. A lot of our focus from some of our participants has been to be more patient-centric, and we can accomplish that by patient-reported outcomes. A lot of times when people hear PROs or patient reported outcomes, they're not really sure what that is. Some of them require, it's basically a clinical measure that helps from a patient's perspective, but it also helps the doctor relate to what the patient's actually feeling. It's no interpretation at all as far as what the care plan should be. So together, between the patient and the doctor, they're coming up with their care plan together.
Hi, Alicia Enis with OSIS, Vice President of Business Development. OSIS is a nonprofit based out of Cincinnati, serving FQHCs, community health centers, tribal organizations, and Planned Parenthoods on NextGen EMR. Today, I'm joining you from NextGen UGM 2024 in Nashville, where we're talking a lot about, of course, ambient AI, looking a lot in preparation for UDS as we add in ECQM measures for our organizations across the country, and also preparing for the NextGen 8 upgrade. So looking at new functionality in the behavioral health templates, as well as new look and feel user design in our practice management dashboards.
So, what are my key takeaways from this year's UGM? Well, number one, customers who have adopted Ambient Assist are seeing the benefits as advertised, meaning that the promise of the ambient voice technology is truly being realized. Takeaway number two, NextGen is hyper-focused on improving workflows and reducing the administrative burden. A lot of the enhancements that they have been working on and will be working on are aimed at helping customers do their work with less stress on their staff. Takeaway number three, no flash, no fancy light shows, no celebrity keynotes, just practical approaches to innovation and improvement. I think that this is a tone that's appropriate for a user conference in 2024. And hey, if you enjoyed this piece, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung, here for Healthcare IT Today in Nashville, Tennessee. Thanks for being here, and I'll catch you on the next video.